Hi, my name is Adrienne. I'm here to do a health assessment today on my patient, so we will get started. Can you state your name?
Jane Doe,
What year is it?
2016,
And do you know where you're at?
home.
Okay. Patient is alert and orientated ×3. Posture is relaxed and upright. Hygiene, clothes noted to be clean, no rips noted, no foul odor noted, speech is clear, no stutter noted there. Hearing, patient is able to carry conversation well and answer questions appropriately. No further concerns there. Okay, we will go to your facial features now. Eyebrows in order to be equal throughout and symmetrical, along with eyelashes, they are equal throughout and symmetrical. Facial structure noted to be symmetrical as well, no lesions noted, skin noted to be pink throughout. No concerns there. I'm going to go ahead and palpate your temporal and maxillary areas. Let me know if you have any tenderness.
No.
Okay, good. I am now going to palpate your temporal artery. Temporal artery is noted to be palpable. Now I'm going to test your jaw movement. Just place my hands, open your mouth and close and side to side. Did you have any pain with that?
No.
Okay, patient denies any pain with movement of jaw, and jaw in order to move smoothly with no limitations. Skin noted to be warm to touch. Okay, now I'm going to assess your hair and your scalp. Hair noted to be blonde and soft blonde in color, soft texture, even throughout, no balding noted. Scalp noted to be pink throughout, no flaking lesions noted, no lice or anything like that. No concerns noted to hair. Now I am going to assess your ears. Okay. I'm just going to brush your hair here. Okay. Ears noted to be pink throughout bilaterally and matching to the rest of skin and surrounding area. No redness noted. I'm going to palpate your ears now. Do you have any pain?
No.
Okay. Patient denies pain to bilateral ears. No piercings noted. I am now going to do a hearing test for you. I'm going to whisper 3 words and I want you to say them back to me.
Ball, cat, mouse.
Okay, patient is able to state 3 words back. I am now going to perform the Weber test. I want you to tell me if you can hear this in your ears and if they're bilateral or equal bilaterally.
Yes.
Okay. Weber test is good. Patient is able to hear the sound in both of her ears. Now I'm going to do the Rinne test to your left ear. I want you to tell me if you can hear it, and then when you can't hear it anymore, okay?
Okay. Okay.
Okay. Bone conduction or air conduction is greater than bone conduction by twice the amount of time to her left ear, and I'm going to do the same with your right.
Okay. Okay.
Okay. Air conduction is also greater than bone conduction to patient's right ear. Ears noted to be symmetrical bilaterally, and the pinna noted to be equal with outer canthus of the eye. Now I'm going to take a peek inside of your ear. Okay. Okay. Patient noted to have light brown cerumen present to the right ear tympanic membrane, noted to be visible and is pearly gray in color. Now let's get this here. Okay. Patient also noted to have light brown cerumen that is soft, and tympanic membrane noted to be visible and is pearly gray in color. Okay, now I'm going to go ahead and assess your eyes. Okay, so I'm going to check out your conjunctiva first, if you can look up for me. Perfect, and then look down. Perfect. Conjunctiva noted to be pink in color. Moist and no discharge noted. Sclera noted to be white bilaterally, no redness noted. Iris noted to be round and brown in color and equal bilaterally. Eyes are symmetrical. Pupils noted to be approximately 7 millimeters in diameter and are equal bilaterally. I am going to have you look over my shoulder. I'm looking down. Okay, pupils. Pearl is present to bilateral pupils. The cornea is smooth and shiny. No roughness noted to either eye. Now I'm going to have you do a reading or sight. If you can cover your right eye and read the smallest line you can.
428739.
Okay, patient has 20 vision to her left eye, and if you can do the same.
428739.
Patient has 20/20 vision to her right eye, if you can do it without covering.
428739.
Okay, perfect. Now if you can follow my finger without moving your head with your eyes. Perfect. 6 cardinal fields of gaze are intact. All cranial nerves are intact at this time. Now we're going to test your peripheral vision. If you could look right at me and tell me when you see my finger.
Okay. Okay. Okay.
Okay. Okay. Patient's visual acuity is intact. No concerns noted with that. If you can close your eyes, and I want you to tell me if you can feel this.
Yes.
Mm.
Yes.
Mm.
Yes. Yes.
Okay. And one more time.
Yes. Yes. Yes.
Yes. Okay, perfect. Patient sensation to her face is intact. No concerns noted. Now I'm going to test your red reflex. Okay, if you want to look over my shoulder, I'm just going to look into your eye. Okay. Red reflex present to both eyes. Patient's eyelids noted to blink spontaneously. Can you close them fully? Patient able to close eyelids fully. No concerns noted there. Eyelid noted to be pink in color. No further concerns. Okay, and now I am going to assess your nose. Nose noted to be midline, nares noted to be equal bilaterally and symmetrical. I'm going to test for patency. If you can just take a breath in and again. Patency noted to be, Nair is noted to be patent bilaterally. If you can close your eyes for me and tell me if you smell this and what is it?
Coffee.
Okay, perfect. Cranial nerve noted to be intact as resident or patient is able to smell object. Now I am going to look in your nose. If you can have you tilt your head up for me. Okay. Okay. Deep red turbinates present to bilateral nair. Fine hairs noted to cover nair throughout. No drainage noted. Mucosa noted to be pink in color. Septum noted to be straight in midline. No deviation noted. And no concerns noted for the nose. Now I'm going to assess your mouth. Lips noted to be pink, moist, and no cracking noted. Vermilion border present. Lips noted to be symmetrical horizontally and vertically. If you could smile for me. Perfect. Teeth noted to be white, straight, and no jagged edges noted. Patient's able to smile and is bilateral or equal bilaterally. No concerns noted there. If I can have you open your mouth for me. Okay. And now if you could say ah. Perfect. And if you can stick out your tongue. Perfect. Okay. Patient is not noted to be missing any teeth. Gum line is pink with no increased redness noted and even throughout. Oral cavity. Tongue noted to be pink with papillae present throughout. No foul odor noted. Tongue is able to move freely and is midline. The ulva and the soft palate noted to be midline and rise upon patient saying ah. Patient noted to have no tonsils present. Hard palate noted to be smooth and shiny. No lesions or open areas noted there. And then oral mucosa noted to be pink, moist, with no lesions or open areas present throughout. No concerns with oral cavity at this time. Now I am going to palpate your neck. Okay. Do you have any pain?
No.
Okay. No pain or tenderness noticed upon palpation. Lymph nodes noted to be noted to have no swelling or warmth noted. Thyroid gland noted to be small and round. Trachea noted to be midline and firm to touch. I am now going to palpate your carotid pulses. Okay. Carotid pulses noted to be present, bounding, and regular. No abnormal rhythm noted. If I can have you turn your head to the right. No jugular venous distension noted. I'm now going to auscultate for a carotid bruit at this time. Okay. Okay, no carotid bruit present upon auscultation. If I can have you bend your head forward, back, side to side, and around in a circle. Range of motion present or within normal limits for patient. If I can have you raise your shoulders for me and then try to push forward. Perfect. Trapezius muscle noted to be strong. 2 bilateral shoulders. No further concerns noted with neck at this time. Now I am going to assess your posterior thorax. Okay. I'm going to palpate your back here. Do you have any pain?
No.
Noted. Okay. No bulges noted. No fremitus noted. Spine noted to be midline. Thoracic walls noted to be symmetrical. Bilaterally, I am now going to percuss your back here. Okay, no sounds, no adventitious sounds noted to percussion. I am now going to listen to your lung sounds. You can take a deep breath for me. Perfect. Okay. No adventitious sounds noted to posterior auscultation. Thoracic cavity noted to expand during inhalation symmetrically. No further concerns noted to posterior thorax. Now I am going to assess your anterior chest wall and thorax. I am first going to palpate your chest here. Do you have any pain or tenderness noted? Okay, how about down here?
No.
Okay, thoracic wall noted to be symmetrical to the anterior thorax. No pain or tenderness noted. No bulges, no masses, no fremitus noted to anterior thorax. Now I am going to have you lean back a little bit so I can percuss your thorax. Okay, no adventitious sounds noted. Now I am going to auscultate your breath sounds. If you want to lean forward a little for me. Okay, you can take a deep breath. Okay, now I'm going to listen to your apical pulse here. Okay, pulse, apical pulse noted to be regular, bounding, no extra beats noted. I am now going to listen to all 5 of your heart sounds using the diaphragm of the stethoscope. Okay, now I'm going to use the bell of the stethoscope and listen to the heart sounds again. Okay, no adventitious sounds noted. Heart sounds sound good. Respirations are to be easy. No shortness of breath noted. No further concerns present with the anterior thorax. Now I'm going to have you lay down and I'm going to assess your stomach. Okay, I'm going to inspect the abdominal area. Abdomen noted to be pink in color. No herniations or distension noted. Umbilicus noted to be free from infection. Okay, now I'm going to palpate lightly to your abdomen. Do you have any pain or tenderness
No.
noted? Okay. Now I'm going to have you take a deep breath and I'm going to palpate deeply. Do you have any pain or tenderness noted with that?
No.
Okay. No masses noted to abdomen on deep palpation. Now I'm going to listen to your bowel sounds. Okay. Okay. Bowel sounds noted to be hyperactive and present every 5 to 15 seconds. Now I'm going to listen with the bell of the stethoscope for aortic bruit. No aortic bruit noted on auscultation. Now I'm going to instruct the patient on doing a self breast exam. If you could raise your left arm and palpate deeply into your breast. Do you feel any masses?
No.
And if you can do it to your right breast as well. Do you feel any masses with that?
No.
Okay. Self breast examination completed. Now I'm going to palpate your axilla lymph nodes. Okay, no swelling noted to axilla. Now I'm going to have you sit up and I'm going to have you close your eyes and I'm going to put something in your hand and I want you to tell me what it is.
Penny.
Yes, you are right. And then if you want to close your eyes again, I'm going to draw a number in your hand and I want you to tell me what it is.
3.
Perfect. Cranial nerves noted to be intact. Sensation noted to be present. 2 bilateral or 2 hands. I'm just going to squeeze this in. You feel that?
Yes.
Okay. Sensation present to bilateral hand. Now I'm going to palpate your radial and brachial pulses. Okay. And then your brachial pulses. Okay, radial and brachial pulses noted to be strong and palpable. They are regular with no extra beats noted, and they are symmetrical bilateral. Now I am going to do your upper extremity range of motion. If you want to stand up for me. Okay. If you want to take your right arm and lift it up for me, and then if you can bring it back out to the side, cross, and then all the way around. Then we'll do the same with the next one. Go up, back to the side, across, and all the way around. And then we will now do your elbows. If you can reach both of your arms out for me, and then bend them across, flex your elbows and extend. Now if you could flip them over into your wrists, bring your hands down and up, side to side. You can spread your fingers apart, squeeze them together, and then touch your thumb to all of your fingers. Okay, range of motion noted to be within normal limits for the patient to our upper extremities bilaterally. Now I will have you we're going to test muscle strength, so if you can put both your arms out, I want you to push against me and then push up. Okay, and then if you could bend your elbows for me, I want you to pull. And now push. Perfect. Now if you could put your hands out for me, I want you to push against. Perfect. And now up. And then I want you to spread your fingers apart and keep them from going together. Okay, and now keep them from going down or up. Perfect. Muscle strength noted to be intact, strong, and equal bilaterally. Now I'm going to have you walk to the wall and back for me. Okay, gait noted to be well balanced with no shuffling or tripping noted. Now if you can walk heel to toe for me. Okay. Perfect, and if you can come back. Okay, cranial nerve noted to be intact. Patient is able to walk heel to toe. No concerns noted. If you can stand with your feet together, we're going to complete the wrong bird test. You can keep your eyes open. Patient is balanced. Now if you can close your eyes. Patient continues to be balanced. No alterations noted. Now, if we can do your range of motion to your lower extremities, I'm going to have you bring your right leg forward and then back, and then I want you to bring your knee up, and now bring your leg out and across. Perfect. Now if you can kick your foot back like this. Perfect. And now if you can stick your foot out again. Oh, okay. Same foot as before. We're going to do your ankle. If you can point your foot, bring it up, go side to side. And now if you can internally rotate your foot and externally rotate your foot. You can crunch your toes together and then spread them apart. Perfect. Range of motion noted to be intact to your right leg. Now we're going to do your left leg. If you can go out and back and then up and then out and across. And then if you could kick your foot back for me, that's good. Now if you can bring your foot out and point it, bring it up, go side to side, and internally rotate your foot, externally rotate. Squeeze your toes together and then fan them apart. Perfect. Range of motion going to be intact to bilateral lower extremities. No concerns noted. Okay. If you could please have a seat. We're going to test your strength. If you could try to lift your legs up for me. Okay. Now pull them down. Perfect. Now try to spread them apart. Okay. You can try to kick your legs out. Perfect. Now pull them back. Perfect. Lift your feet up. And then try to push your toes down. Perfect. Patient's muscle strength noted to be intact. Strong and equal bilaterally. No concerns noted. Now I'm going to feel your pulses to your feet. Popliteal pulses palpable and present to bilateral lower extremities. Now I'm going to feel your tibial pulses, which are present and palpable to bilateral tibial areas. And now I'm going to feel okay. And then I'm going to feel your popliteal pulses, which are present to bilateral legs, strong and equal. Now I'm going to do your reflexes to your lower extremities. So we'll start by okay, now I'm going to do your ankles here. Perfect. Okay, reflexes present to bilateral extremities or lower extremities. Now I'm going to do your reflexes to your upper arm here. Do your, okay. Okay. Now we'll do the other one. Okay. Reflexes are strong and present to bilateral upper extremities as well. That should complete our assessment. Thank you.